to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Anne Margolis, speaking on empowered mothers equals healthy pregnancy plus birth. Anne is a licensed certified nurse midwife, a licensed Femme teacher, certified Clarity Breathwork practitioner, yoga teacher, and practitioner. She's a third-generation guide to mamas birthing babies in her family. Anne has helped thousands of families in her 20-plus year midwifery practice and has personally ushered the births of over 1,000 healthy babies into the world. She's also guided countless human beings to heal from emotional pain, inner stress and trauma, tap into their strength and power, live fully and vibrantly, and reclaim their radiance, joyfulness, calm, and overall sense of well-being. For more information about her and her practice, please visit homesweethomebirth.com. Hi, Anne. Welcome to the show. I'm so excited to have you on today.
I'm excited too.
Yeah, this is going to be great. You and I have a lot in common, and we're both really passionate about empowering mamas during pregnancy and birth. And I feel like we both really understand how important that empowerment piece is in order to create a healthy pregnancy and birth. So let's start off with having you tell the audience a little bit about yourself and why you chose to become a midwife.
Well, it's so interesting because empowering was I didn't know anything. Like my first experience having a baby was the most disempowering experience. So so when I was I became a midwife back in I became a nurse back in the 80s because I loved obstetrics. So my first job was I did med surg because you can't do obstetrics until you have a year of medicine and surgery, and then I went into obstetrics. And it's there that I developed fear of birth because I was seeing, and it was a local community hospital, and I was seeing like a lot of problems from the routine interventions that were done from anyone that was just walking in to have a baby, people who were healthy walking in to have a baby. And as a nurse, I was having to rescue. The stress and rescue, like a lot of problems caused by the interventions, just routine interventions on people that weren't sick or didn't have problems. And this is not what I was taught in nursing school. I didn't know about midwifery yet. I just knew that something didn't feel right. And when I was really attending more cesarean births than I ever imagined, and I'm a dancer and a yoga, very athletic, and a yogi, and I was very scared of having major abdominal surgery. I think that was my big tiger, my big fear, and but I didn't really know better. When I got pregnant with my first baby, I gave birth on the unit where I worked. With the obstetricians that I liked, I was given the royal treatment in that, a nurse on our unit is going to have a baby, so I was given the royal treatment, but it was the most disempowering, traumatic experience of my life, of my adult life. So kind of just, I'll walk you through. I as soon as you get into the hospital, and as soon as they, say, okay, take off your clothes and put on the hospital gown, that's what sick people wear. And it kind of it's like you're stripping yourself of your power, of your individuality. And then you become dependent on them. Right. And the doctor kept coming in, and I'm attached to a monitor. I can't move, and I got the IVs. I can't eat or drink, and no animal could be laboring normally in that circumstance. But so no surprise, the doctor kept coming in and checking me and saying, "You're still 4." He actually didn't say it to me. He went out to the nurse, and I heard him I heard him outside going, "She's still 4." And I know what that means. That means I'm not progressing. Right. And, he told the nurse, "Give her pit." And the nurse comes in, who's a colleague of mine, and she's just putting Pitocin in my IV. And I'm like, whoa. I don't want that. because I've seen what that does. And, and she says, oh, but honey, you don't want a cesarean, so she meant well, but that feared the heck out of me. And no, I didn't want a cesarean, so then that started the whole cascade, of more interventions, because my Lamaze went out the window. Then I couldn't cope with the more severe contraction pain that I was feeling. And I can't, you can't move really. It's attached to the monitor, and I needed epidural. And then what happened was, from the epidural, the baby's heart rate dropped dangerously low, and they called a stat section, which of course was my biggest fear. And here I was, everyone was looking panicked, and I see their faces, and, they had minutes, given how low my baby's heart rate was, they had minutes to get her out. I knew that. And so I'm in the OR by myself, looking at the clock. Okay, when are they doing this? When are they doing this? Nobody's monitoring me. Nobody's with me. Nobody's listening to my baby's heartbeat. And I'm watching the clock go, 10 minutes, 20 minutes, 30 minutes, 45 minutes, an hour. And the assistant surgeon never came. So in that time, I went from, oh my God, my baby's going to be damaged, to, oh my God, my baby's dead. That's what went through my mind, and my young mind of 24. And somehow the drugs took their effect, and I needed to push. In the operating room, the assistant surgeon never came, and I started, calling out for help, and the surgeon came running in, the OB, who's a surgeon, and he starts to panic, and he's yelling, get me a vacuum, and he cut a large episiotomy, and he vacuumed her out, and I did not want to see her, because I was convinced she wasn't alive, and she was fine. So that shows you, I wasn't fine, but that shows you the false diagnoses a lot of times of the fetal heart monitor that makes everyone freaking out about, we're continuously monitoring the baby's heart rate, but they did not diagnose a stress for my baby, right? My baby was fine. Was breathing. They don't know about the, I'm very into the trauma and the emotional, and this, the how acutely aware newborns are of, and how sensitive they are. But nobody cares about that. They're really focused on, is the baby have a heartbeat, and is the baby breathing, and not brain damaged, right? But anyway, so that was, it took me a long time to get over that. I was traumatized. I didn't want to go back to work. I didn't want to talk about it. Now I know what birth trauma is. But, and of course, I told my husband I'm never having any other babies no more babies. And then 2 years later, I'm pregnant again. And of course, I had another experience, not all that different. And I was talking about my frustrations to a friend of mine, and she says, why don't you just be a midwife? I'm like, what's a midwife? And this was in the late 80s. And she, I didn't know, but she told me, and I got really excited about it, and I researched it, and I'm like, oh my God, like, this is me. I got to do this. And it's just like a total shift in paradigm. When I went to midwifery school, I came home. Because in midwifery school, I realized that women can birth like they breathe, like their heart knows how to beat, unless there's disease, right? Like our lungs know how to breathe, unless we have, God forbid, asthma, emphysema, this lung disease, right? But the healthy woman, her heart knows how to beat, her lungs know how to breathe, her body knows how to grow and birth and feed her baby. The power is restored to the woman, and it was such a shift in paradigm, and it was like, I'm home. And it was in midwifery school where I saw birth being beautiful. I saw birth being spiritual and life-changing and peak life experience for the family. I saw humanity restored to the process where it was almost removed from the process in the hospital where I was working. So then I was pregnant with my third baby, and I'm like, okay, I'm using a midwife now. But I said to her, I was traumatized by my first two. For me to authentically promote this, it has to work for me. like I have to experience it. I have to feel it, and she said, oh, don't worry. It's going to be so different. You're going to be so healed and blah, but I had to feel it myself. And she was so right. It was beautiful. It was how it should be. She was very skilled at doing nothing, which is what the best intervention in a healthy, pregnancy and birth is, to allow the woman, respect and honoring of the process, right? And allowing the birth to take place in its physiologic, natural form. And of course, intervene. Like, I knew she would know exactly what to do if there was a problem, but she was laid back. She was calm, take a shower, go in the bath, just trusting and allowing and supporting with love and care and respectful of me, and my choices. And it was so healing and so beautiful. I wanted to shout from the rooftops, like, wow, like this worked for me. Like I'm choked up even thinking about it. Like I can now authentically, convince any woman who was interested in being convinced, right, that she could do it. Because if someone doesn't want to, if someone's not interested in this type of approach, I'm not out to change her mind. But, I get, I'm definitely passionate about spreading information and inspiration to empower women to take back their birth, to know that they have options and that they have choices. And so this is what I've been doing for 25 years. Yeah.
Wow. So the first 2 births were with OBs in a hospital. And then you had 2 more babies with the midwife, and were they both at home or in a hospital?
Well, I didn't know about home birth then, but there was, I could have had them at home. It was very much like a home birth in a hospital setting. I wore my own clothes. I brought my own things. I was able to eat and drink. I wasn't encumbered. I really did not. They were beautiful births. Yeah. Midwifery births in a hospital. And I work now, I've done both hospital, home, and birth center births. And there are plenty of, women, for example, and this is what I'm passionate about. There are plenty of women who, for whatever reason, they don't want to have a home birth. Their insurance doesn't pay for it. Someone's not supportive of it, or maybe they can't have a home birth. They have some sort of a complication or some serious issue that makes it's safer for them to be in the hospital. So why can't they have a home birth like experience in the hospital?
Right.
So I'm very passionate about helping women do that. Mm-hmm. So I did not know about out of hospital birthing till later on in my career.
Mm-hmm. And now, like you said, you as a midwife will do all 3 types of births, like any location.
Yeah. Well, I don't work. I work. Actually, I do hospital births, and I was a home birth midwife for 21 years. So, both.
Yeah. I know in New Jersey, it's exciting. We finally have some birthing centers that have opened, and that's a big deal because for a while that was not even an option for women. It was either home or hospital. And it's nice, like you said, some women don't feel comfortable giving birth, are not candidates for home birth, but yet also don't want a lot of interventions if possible and want a home birth like birth. And they can do that now in a birthing center.
Yeah, absolutely. I actually, when I was in midwifery school, the Childbirth Center with Lonnie Morris was still open, and that's where I did my birth center training, my out of hospital training. So when I was in midwifery school, I'd heard about home birth, but it was, I just didn't know that was like I didn't realize how much of an incredible option that was, or a viable option, but it's a big option.
Yeah.
That's available to, that around the world. And that's basically how we were, how women have been giving birth throughout history.
Right. Yeah. It's awesome. So let's talk, because now you have that personal experience, you have professional experience around the difference between a midwifery-based birth and working with an OB. What are the current hospital practices going on and birth stats, and how can we possibly improve them?
Well, our country, the United States of America, ranks the lowest in terms of maternal morbidity and mortality around childbirth. We are losing more mothers than any developed, and I'm talking around the process of childbirth, compared to all other developed countries, which is like horrid. It's hard.
And we spend more money on healthcare than any other
more
country.
More technology. Right. Yeah. High technology, high cost, lots of money, lots of interventions. And we're not getting, our outcomes suck.
Right. They
right?
do.
And we're not doing great with the newborn either. And so if you look at the countries around the world that are getting the best outcomes, you've heard of Dr. Marsden Wagner?
No.
He was the former, he's a perinatologist, a high-risk obstetrician who was the former head of the maternal child health department in the World Health Organization. And he's written many scholarly articles and many books really uncovering a lot of this. And people ask him, why are you such a supporter of midwifery? Why do you love midwives and midwifery care? He goes, I support the evidence. He says, if you look at the countries around the world where they have the best outcomes, losing less babies and mothers, having less mothers and babies being sick around the process of, or damaged from the process of, giving birth. These are countries in the world like Holland, like Sweden and Norway, where the bulk of the healthy low risk women are seeing midwives, because midwives specialize in the management and the care of low risk healthy, which is the vast majority, but they need to work in collaboration with obstetricians who are surgeons. We need them, thank God. We need high risk. And there are people that have, for example, seizure disorder, heart disorders, insulin dependent diabetes, high blood pressure. Expecting triplets, right? So they would benefit more from the high risk sort of approach of all the interventions and the care that the obstetricians would do. And so when you have this team approach where you have the midwives serving the vast majority of the low risk healthy, it frees the surgeons, the OB/GYNs are surgeons, and their expertise is using surgical tools, medical tools to diagnose and treat. And so we need them both. And so when you have this team approach, we get the best outcomes. What we have in the United States is this high risk approach to the healthy. And we're fixing things that aren't broken, which are making them broken.
Right.
You know what I'm saying? Like when you apply high risk care to the low risk population. So that's where, so that was coming from a physician, a high risk obstetrician who has since passed, but his message still holds true. I'm pretty mortified by what I see in a lot of the hospitals still. There are some wonderful hospitals around, few and far between, but where there, I would say is, it's more midwifery supportive or more natural, natural physiologic, pregnancy and birth supportive, but some are still practicing like there's not a lot that has changed. Right. You would think, right, that there should be more change, but there's really not. It's actually getting worse, I think. And just from what I hear, I the reading, and I'm very involved. I have a big social media following, and I have people that contact me from all over the world, and I'm pretty amazed by what I'm hearing and reading about some of, especially our country, what's going on in some of our hospitals.
Right. And I think in some cases, like with hospital policy, there's a lot of CYA and a lot of concerns about litigation. Right. And I think maybe in the U.S. there is more lawsuits perhaps than in other countries.
Yeah, it's very
Yeah.
complicated. Like,
But
why?
why?
Right?
And
Why?
so I'm always about root cause. Like as a chiropractor, I'm always wanting to know root cause. And I think when we talk about what is the
We need an
why,
adjustment.
yeah, what is the why here? It all boils down to fear, right? Decisions and policies and women's even thought process around birth can be, there can be a lot of fear-based decisions being made here, and that's impacting the outcome here. So why do you think there's so much fear?
So yeah, there are a lot of reasons, I think, for what's going on. I don't think it's only fear. I think that the problem is so deep and systemic, and there's multiple causes. Like, it's not like I don't want to paint obstetricians to be evil, hospitals to be evil. It's our system is broken, and like the approach that I've taken is like it's almost overwhelming. Like, I don't even know how to change policy. I don't know how to go in and change, public health and the standards that govern the way, like ACOG, for example, and pharmaceutical companies and these AMA and, the American Medical Association and a lot of these big money, big, powerful political organizations that are, doctor run, for example, with their vested interest. And like you say, the litigious nature of our society, malpractice insurance, and I think a lot of people expect perfection, and they kind of go and assume that the hospital and doctors know best, and they've almost relinquished responsibility. So the way I feel the best is to change things is to empower women, to empower families, to learn about it and to speak up respectfully. And it's when passionate women speak up throughout history, or when passionate people have spoken up throughout history, that's where we really get the change, I've heard amazing things. I mean, so I have this online course this is how I bring women through my practice, to empower them to have, the most holistically healthy, beautiful journey from pregnancy, birth, and postpartum. And this woman who was in Central America because her husband was stationed there for work, took the course. And she wrote me this amazing letter. I'm amazed by the story. She said she was in an area where the only obstetrician she didn't want to use what they call as traditional midwives. Like, she was nervous about that. People that in that country, that they weren't really so trained, and that just made her nervous. So she went to an obstetrician. It was a very rural area, and the only one that was available is one that doesn't really. He didn't even know what natural birth was. Like, he had a section rate of like 90% or more. The ones that didn't get sectioned and were probably those who delivered in the car on the way to the hospital or something. Yeah, but anyway, she she approached him and she said, "I want a natural birth." He says, "Well, I don't do that, And other people might have said, "Okay, like, best. You're a doctor." But she was empowered. She was knowledgeable, and she respectfully spoke up after taking my course. And she said, she really wants a she wants no intervention and she wants to be able to eat and move freely and drink. And, she had a whole list of things that she wanted to do. Of course, she was open if something went wrong, that he should be, he would do his doctor's expertise, but she really wanted this hands-off approach, and he was very nervous about it, but she convinced him. Well, she had the most beautiful birth, and he was brought to tears. And just think of the ripple effect that will have on how he practices and treats other women.
Wow. He didn't even know what he didn't know.
Right. He didn't know. He was taught, he wasn't taught about normal. Something that's very interesting in terms of our training. Like, in midwifery school, we're focused on the normal. How do we keep things normal? How do we How do we support the normal? Yes, of course. How do we, when the things are deviating from normal, what can we do most simply and naturally? And yeah, sometimes we need to pull out like holistic care. Sometimes we need to use modern medicine, right? But for the vast majority of times, it's really how do we support the normal? And doctors in their education, they're learning how do we treat disease? How do we diagnose and operate and use medications and all that kind of stuff. So it's interesting. My father is an old school physician in internal medicine, and he's always calling me about like nutrition and, because a lot of his patients with diabetes and high blood pressure, they just want a pill. And he wasn't taught like how to help them like with their lifestyle. Right. It's not just about the pill. And so I just think that that's an incredible story. And I'm hearing more and more of that, just like I think when women and their families will speak up respectfully, because this is your body, your baby, your birth. It's not like you're asking to do something that's, reckless. There's a lot of literature supporting the safety of physiologic normal birth and not to do anything with it. How to support it. You've heard of Dr. Michelle O'Don?
Yes.
Love him. So in a midwifery conference, there was about, I don't know, a good 500 midwives in the conference. It was, an international midwifery conference. And he's this obstetrician, French obstetrician who does home births in England. But he was, did hospital births for many years, but he's also a very big supporter of physiologic birth and midwifery. And he asked at the conference, what is in his French accent, which I will not imitate, but I love it. What is the best intervention that an attendant can do at a healthy, normal birth? And everyone's raising their hands, and they were all, kind of wrong. That's not what he had in mind. His answer was to knit, KNIT, yes. Knit.
Do nothing except.
You know why?
Keep your hands busy.
Yeah. Because a provider feels they need to fix something. Keep your hands busy. Right. No, if you knit, your hands will be busy, and you'll be busy off the woman. But yes. You're exuding calm, because a midwife or a doctor who's seen thousands of births and knows when things are normal, they can sit back and they can knit, and their eyes are open, their heart is open, their ears are open, they're with that person. But that calm is contagious, and that woman will feel that calm, and she'll be able to relax into her body and into her birth. Whereas if an attendant is nervous, that's gonna meddlesome, then that is more detrimental. So I thought it was a brilliant answer, deeper than do nothing,
Mm-hmm. Right.
But I don't knit.
Right. I think Ina May Gaskin said that before too.
Well, they're friends.
Yes. And at the end of the day, it's really, I love like you're speaking on, it's not even just not intervening, but it's the energy in the room. It's not only the birth provider, but it's the partner and any doula or anyone else that you choose to have at your birth, ideally are also coming from a calm, supportive energy.
Supportive, trusting in the birth process. Yes. Trusting in the ability of that woman, even when she doubts herself, even when she says, I can't, right. Just trusting in that. And and respectful of the so many unique varieties that can go on, between personalities and between, each birth is different, even though there's similarities, there's differences, right? And right. So, yeah.
It's so true. So can you tell us a little bit more about your online program?
With the course?
Yes.
Yeah. Oh my goodness. That kind of started, the whole social, like my online presence was kind of like an accident, because my expertise was always, with the family in person, right. But I'm very, passionate about inspiring and empowering women and supporting them and encouraging them and spreading this message of that they can do it and that they can learn to remember what their body forgot, what their body already knows how to do, and how to, we'll get back to the fear, but how to build confidence again, restore confidence again. So my daughter said, "Mom, you should be on Instagram." And it was about 5 years ago. And I'm like, "What's Instagram?" Like, I but she's got all these, you got all these cool pictures, and it would be perfect for what you like doing. And she gave me the 101, and I was off and posting, and then who knew, it became it's now over 100,000 followers between Facebook and Instagram from people all over the world, and that caused it birthed a bunch of stuff like interviews and people reaching out to me from the Philippines, from all over Canada, Europe, South Africa, everywhere, all over the United States. Europe, my doctor says this, and what's, for my high blood pressure, what do you recommend holistically? Or I had a traumatic experience my first birth, and I want to have a better experience next time. What do you suggest? Or how can I have a natural, my husband's against my home birth, but I'm not sure. I was getting all these questions from people all over the world. And so that kind of birthed this online consulting, because I can't answer these questions on Instagram. And then there was an interview I had with somebody in San Francisco who happened to have been a very passionate doula who was inspired by her own birth, but her real job, her full-time job was more film and editing and marketing for a big firm. So she had this podcast and she was interviewing me, and she's like, "Do you travel?" And I'm like, "I love travel." She says, "No, I mean, if, I'm in San Francisco, do you, would you ever come and attend a birth here? If I want your approach." I'm like, "Oh, I don't know that I want to travel to do that." But she says, "Well, then you need to make a course." I said, "What do you mean?"
Right.
So she says, "Well, listen, I'm in film and editing, and I want to invite you to come out. We'll take 5 days. We'll shoot it. Just how you bring people through your practice, in the pregnancy, because we what are the pros and cons of all the different interventions and testing and that people, pregnant women and their babies are exposed to, right, from the whole journey from pregnancy, birth, postpartum. How can she liked my because I'm a yoga teacher, practitioner. She liked my sort of yogic approach, how to help people on a very holistically, also mind, body, heart, and soul, how to love their pregnancy, how to love their birth. It would not, birth in pleasure. I was in the Orgasmic birth video movie and book, and I'm very, it's not just about how can we bear this, how do we get through it, I'm scared, how do we love this?
Right.
This can be an amazing experience. Yes. How can we bring pleasure into it? Why not? Right? Yes. Okay. Marathon runners and athletes and dancers and all are feeling intense sensations at different times. It's not easy running the 26-mile marathon, right? But it's a mindset. How do we shift our mindset so we can actually love things that are hard? How can we relax into intensity? Right. And so, yeah, I created this. I took her up on it. I went out and we went to Point Reyes. We rented a cottage. She became a really good friend of mine, and we spent time, shooting this course. And it's 10 modules, and it goes very in depth into it's for everybody. It's not just home birth. Anybody who I don't even if a woman wants an epidural, she should make an informed decision about it. But she still, needs to prepare for how to have a wonderful, beautiful, healthy pregnancy and how can she deal with labor before she gets her epidural? And sometimes the epidurals don't work, and she's got to push her baby out, and she's got to she's got to feed her baby, and she's got to deal with postpartum. So So the course is how I basically take people through my practice without the hands-on care, and to help the partner. What, it's a whole module like on for partners and just coping with labor, but much deeper. It's how do we shift the mindset? How can we practice techniques in the pregnancy so that they become habitual, so that we can just find our calm, find our grounding, find our breath and relax into the intensity and actually embrace the intensity and love our experience. So yeah. And then, breastfeeding, newborn care and postpartum. How do we prepare for the support postpartum, which is like the forgotten fourth trimester in this country? It's incredible. We are letting people go from the hospital 2 days after they've given birth vaginal, 3 days after they've given birth by cesarean without any support. Who does this? Like in countries around the world, many countries, the women were surrounded by the women in the community, and they were off. All the other women in their village or tribe or family or community, would be taking on the cooking and the cleaning and the childcare and the housework and the errands. So that it takes a village to raise a new family, and so. I'm really big on how can we create that, because so many women are alone and isolated in this modern culture of the modern world. And how can we create our community, even if we don't have one? And so, and how can we create that support? And so that's a big part of it.
Yeah.
Birth preferences are a big part of it.
Right.
I counted, there's over 50 different interventions and tests and procedures that could be done to a pregnant woman along her journey from pregnancy, birth, and postpartum. So what do instead, like a lot of people, they just go to their provider and the doctor will, or don't even think to question, like, what are all these tests? Why am I getting all these ultrasounds? And what are all these, screenings and is it necessary? Is it something I want? And it's not about avoiding everything or wanting everything. It's looking at it, discussing it with your partner, thinking about the pros and cons and making a choice. Do you want it? Do you not? And then you take that, and it could be something as innocuous as, do I want my kids at the birth? Right. It could be, do I want my birth filmed or not? Do I want my partner to catch the baby or not? Or all the way down to, do I want, how do I feel about an episiotomy or having my water broken so it encourages the family to look at all these things and then bring it to their provider and have a discussion. And if their provider is not on the same page as they are, then they need to find a provider in a setting who is, and so it really helps because a lot of people don't even know what to ask. They don't know what to ask. We're so removed from birth, many people in this society. It used to be that birth was in the home, so you were raised around it. So you saw your older sister, you saw your sister, or your aunt, or your mother. It was just part of the culture, right? So now it's removed and into the hospital, and people hear fear and face stories or the media hype of making this dramas about emergencies on the television or movies around birth and crises, and so that also creates some fear. So,
I wish I knew about your this course when I was pregnant. Sounds amazing. There's just not in my opinion, there's just not enough positive, empowering information for pregnant women out there. There's so much, like you mentioned, just even culturally with the media and TV about like what pregnancy and birth look like from a very negative place, right? And it's scary for women that are viewing that and not recognizing that they can have something different.
Yeah, and there, I think that there's a misconception. Well, it's so interesting. There's so much of it. It's so complicated. There's a misconception that 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 sort of doctors and hospitals know everything and will take care, and it's safe. It's safer in the hospital, which is really a misconception because we're losing more mothers and babies in our hospitals than any other developed country in the world. Right. So, and look what happened to me, God forbid if my baby really was in trouble an hour, from the time they called the C-section to when she was born, would have cost, would have resulted in a damaged or dead baby if there was serious distress that was going on. Right.
Right.
So it's right. So
I don't even.
It's not always the answer. Look, home birth.
That C-section and wait an hour. Like, I don't even understand that.
Well, it's just, that's so, yeah, that it is concerning, so what's also interesting is I in my hospital practice where I work, there's a large immigrant population. And who do you think tends to birth really well? The Americans or the ones coming from immigrants, like from indigenous cultures that are migrating to the United States?
Right.
Who do you think?
They are, because number one, that's normal to them, right? Their mothers, their sisters, their friends gave birth at home, and they were, and multiple times, a lot of them come from large families. They've witnessed a natural physiological birth, and they've witnessed women breastfeeding, and they know how it all works because they've seen it and experienced it, and they trust it, right?
Yeah.
And a lot of times too, I find that they're not sitting all day at a computer, so they don't have weak cores and pelvic floors and that as well.
No, they're not Googling everything. Meaning they're not so much in their head. I'm not,
right.
Meaning, they're also, I think Americans in our culture, it's like, have a headache, take a Tylenol. Any pain, it's something's, numb it, escape it, and it's just, these people are not taking childbirth classes. They're just coming in and doing it. Like, it's not a big deal. And you know what? For animals, it's not a big deal either. They just birth. No, they're not in their heads. And Ina May Gaskin says, let your monkey get into your inner monkey, okay? Like your inner tiger, whatever it is, let your monkey do it. I mean, these are, we have to, we, in our modern day society, we are too much in our left brain. Right. We need to get out there. We need to garden. We need to dance. We need to sort of cultivate our creative right brain, our intuitive side, and get more in touch with our biologic sort of, like, it's almost birth is it's almost like the last thing that's here with, in this high-tech society that really connects us to, like, biology. Primal. It connects us to our cells, primal, the earth, the spirit. Like it like you can't be in. I mean, I had this one young teenage mom. She spent her entire labor on her cell phone, but she did it.
Oh my God.
She was doing, yeah, but it's like it labor like is so intense. It kind of so like whoa, like we just got to be in this, and it's like as real as life gets, and who I find births really well is people who farm and garden. They're just used to, like, it does, you plant
squatting and strong.
Yeah, well, yeah. And it's just like, it's not like you push a button and, corporate computer people, we're used to, like, you push a button and immediate effect, right? Whereas no, you plant a seed and it takes a long time. And for that to grow into a plant, to grow into a firm rosebud, to blossom into these things take time. And when any farmer knows, if you try to if you see a chick trying to get out of its egg it needs to get, do it on its own. And if you went and tried to help it, it would die. So it has to go through its own process to get out of the egg to hatch. Right. And so it's just it's very interesting, just like the observations I've just noticed over just doing this for so long. But what the good news is that the modern woman can certainly learn, relearn, or to get out of her own way, and let her body do it, and love the experience. Absolutely. And
yes.
And you asked about fear. Yeah, a lot of women tell me they're really scared. They're scared because their friend told them this, or they saw this, or they read this, and I love fear. Bring it on, because I'm not scared of fear. Like I've held women, well, in labor, I'm talking about, I've held women, but before labor, we talk about, like, what are you afraid of? Let's talk about it. Like, sometimes we just have to, like, name it and, just have a discussion about it. And sometimes it's just a total misconception on the mother's, part. Like, she just has a misconception about something. It could be that she needs to learn techniques. I love breath work and yoga and meditation, for that, and breath work, the conscious connective breathing for clearing stress from the body that's beyond the conscious mind, that because we can only talk about what we're conscious about. There's a lot of stuff that's going on in the sub and the unconscious that breath work taps into. So it's not necessarily about getting rid of fear. We certainly lessen it, and we I love teaching families tools on how to boost their confidence and deal with anxiety and fear, and bring them and touch that inner calm, like get and do it often enough so that it's like I said, like habitual when they're in labor. But, I've held people in labor when they're birthing, and all women, they get to that intense, the most intense part of labor, where they say, I can't, I'm dying. Really, I'm scared. Like, this is not working. I'm going to burst open. I'm going to lose control. And I'm like, okay, I got you. Like, I know she's not going to do that. But I can hold her in that place. I'm not scared of the fear, and I just sometimes she just needs to be held. I got you. You're doing this. I see you're doing this. Everything is fine, and then when they kind of just relax into the intensity and stop fighting it, then they birth. They kind of have to feel the fear and do it. That's courage, is feeling the fear and doing it anyway.
Right. Yeah, giving birth naturally is courageous, for sure.
Giving birth by cesarean, giving birth by epidural, it's all courageous, because women are rock stars. What we have to go through, I'm telling you. Yeah.
I was hoping you could expand a little bit more about the breath work that you do, and especially related to like releasing past trauma or possibly even PTSD from a previous birth.
Yeah. Oh my gosh. The breath work. Yeah. So I've always been into there are tons of evidence and research about the power of using breath to hone powers of concentration, to call, yogis have been doing it for thousands of years. Navy SEALs are doing it. Like any top warrior, any person in high functioning, high performance, dance, move with the breath. You need to be able to, especially like Navy SEAL. I mean, it's amazing the high performing peak sort of performers, wherever it is, warriors or yogis or in the Navy and the Army, they need to be able to be very good at mastering their concentration, and how can they calm themselves and so that they can really function and act. So there's been a lot of research, not just on, the huge health benefits of breathing, using our maximum lung capacity and using breath to cultivate calm, to cultivate states of ecstasy, to increase heat in the body, fire, energy, or more meditative. So there's a ton of research on the health benefits of that. But the breathing for trauma is using breath, and it is also a lot of research on it as well. Using breath to release trauma and pain that's stored in the body. And so it's that's a whole discussion in and of itself. So, for example, when animals in the wild, like a deer, for example, sees a tiger or is aware that animals are always in an alert calm. That they're operating in this parasympathetic nervous system of alert calm. But we have the stress response, the sympathetic nervous system. Is this tiger going to eat me? So if the deer sees the tiger, so the stress response goes, and that's normal. We study the trauma response from looking at animals. So that deer has three choices. It can run for its life. It can fight the tiger. With the sympathetic nervous system activation, it has the power to run really fast for its life. It can also play dead. For example, if the tiger's too close and it can't get away, the last resort is it will play dead. The body shuts down. It almost like anesthetizes. If the tiger does eat the deer will not, like, there's much less feeling of the pain. But it's also a defense mechanism, because the tiger will think that, oh, I got this one, so I can go get another deer, and this will, this one's already mine. And when the tiger goes, then the deer will escape. What if the deer makes it to safety? Like all mammals, they shake it off. They move the energy. Stress is this huge amount of energy that just needs to, just kind of like anger or grief. It's you watch a toddler who embodies their emotions without shame. They embody joy. They're radiant. A baby who is full of joy is just joy. like they're not toning it down for anyone. They're themselves joy. But when a toddler is angry, or not getting the ice cream they want, or they're sad because you took their ice cream away because whatever, they're going to have a temper tantrum. They are going to embody grief. They're going to embody sadness. They're going to have a huge anger temper tantrum, move it through their body. They reset, and then they go play. So that we got a little screwed up as we got cultured to be older children and adults, but we got it as babies and toddlers. And so animals, same thing. They shake it off, and then they resume being in the alert calm. So what happens is being holistic and in my approach, I was hearing from a lot of women, history of sexual abuse, child abuse, just it could be trauma from a critical parent, this toxic relationship, a dysfunctional relationship in the family, a loss of a parent, a lot, earlier childhood wounds, and then there's adult wounds that are compounded upon them. And I was very fascinated and passionate about how to help them. But I was also realizing that I was midwifing everybody but myself, because I had a lot of abuse from my childhood that I didn't realize was affecting me. My mother was mentally ill, snapped into a mental illness when I was about 9, and she became very abusive. And, I kind of, like what any child does, just bury, repress, deny, escape. And it was kind of haunting me, but I didn't realize it. And then, there was a series of adult stresses that had happened to me. One was, one of my daughters had a terminal illness. Thank God she survived the bone marrow transplant and all that. But these things, and my own birth trauma, right? So I had gone to so many different. I was doing hypnosis. I was doing all the holistic modalities, but nothing was working. And I eventually took myself to a psychiatrist. my primary care doctor, even as integrative as he was like, maybe you just need a little, medication, and I tried things and nothing, it was made it worse. And finally I took my, when I hit my rock bottom, I think was when my daughter it was that 8 years of that dealing with the chemo and the illness and everything. And I took myself to an integrative psychiatrist at Columbia. And I said to her, I'm absolutely going crazy. Like, something's really wrong with me. And I started listing all my symptoms. She says, she spent an hour and a half with me, and she says, you have PTSD, chronic, from the chronic stress of, handling birth emergencies, handling my own trauma from having my birth traumas, being raised with the kind of mother that I was and the rest of my family. And it's in your body. You can't heal that from talking about it. You can't heal that with medication. That has to be healed through the body. And there's somatic experience. There's different modalities that we use to help the body release these energies and reset your nervous system. Your body has not been allowed to process through a normal trauma response like animals do. So now there's a lot of research on this. Peter Levine is the father of that and somatic experience. But so that was the biggest aha for me there. And I was so excited that I wasn't like going crazy. And it was around that time that I went on a yoga retreat with a girlfriend, and there was in Costa Rica, and there was somebody there on the retreat that was doing this sort of, it's called rebirthing. It's like it's a certain type of breath that puts you in a subconscious state. And with the sort of the midwife of the breathwork practitioner, enables you to really get into that state, and your body just releases and resets on its own. And the breath is, in spirit. So it's got physical, we're using 100% lung capacity. So there's a lot of physical benefits. It alkaline.
Right. Alkaline.
Alkaline. Yes. Creates alkaline state in the body, and there's a whole list of benefits of using 100%. We're using about 20 to 30% of our lung capacity. So this type of breath is really accessing 100% of our lung capacity. And then there's a lot of so we talked about sort of the emotional, like allowing the body to the body's very wise. Like when we get out of its way, it just kind of like releases and resets. That first session I had with her, I literally felt like I took like 3,000 tons of bricks I was holding for many years, and I just dropped them. Like, that's how it felt. It was so transformative. I got out of it, and I was like, what drug did you just give me? Like, what was it? Like, it was so, I felt like she gave me some psychedelic something, and it was like, no, this is breath work, and this is, so that was many years ago, and that started me on this whole journey. And I saved my own life with that. And then I became a practitioner myself. And I do it, for a lot of, for men, women, their families. And it's amazing. It gets the body to just release and reset without having to analyze it, without having to know or think about it. And
you don't need to know the details.
No, your body just, it's energy. Like, and it's very similar, helping someone rebirth or helping someone sort of heal and release and reset is very similar to helping someone give birth to a baby, because they get some, sensations. Sensations are going to come up. And sometimes things are positive, sometimes things are negative. Sometimes there's pain, sometimes there's bliss. There's all sorts of things and all sorts of sensations that happen in the body. And can we relax with them and embrace them and magnify them? And then, we go deeper into this. And then we get to this, like, it's really considered, Dan Brule, who's wrote the book, Just Breathe. Andrew Weil is very big on, but there's a lot of physicians now that are and scientists that are talking about this. But Why am I mentioning that? Oh yeah, he calls it spiritual breathing. It's a form of spiritual breathing because the yogis, like, prana is spirit, it's life force, and even whatever the Judeo-Christian, Muslim, religions talk about Adam and when God created the first human, he gave life to that person by giving them breath. So you can, with the power of intention, when you're breathing, just think of all sorts of the sort of like the miracles that can happen when you have this intention to heal, to let go, to raise your vibration, whatever it is, to release, to have more joy, to have more, whatever it is you're working on, knowing that you're taking in 100% of life force, of this sort of spiritual energy into your body, so that miracles can happen. There's I've witnessed miracles, I've experienced miracles, and I find that this by far is one of the most, I think, effective ways. But to not just heal emotional pain and stress, but to really have vitality and like joy, vibrancy, like feeling alive and connecting to the deep essence of who you are. It's very empowering. And it's this amazing tool that's free.
Wow. Yeah.
We just have to learn how to do it.
To learn how to breathe, to move energy and release what is no longer serving you.
Yeah. And you don't have to know what it is.
Yeah.
we talk, we process after a session, we'll have a discussion, but it's not about the story.
Right.
You have to get out of the story and
right.
Healing is through the body in that way. And I've seen like major, like people who have come to it just because they want to, enhance their lives, heal like long-term chronic health issues that they didn't even know were related, like the mind, body, heart, and spirit is so connected, and so. Yeah, that's another passion of mine.
I love your passion, and I could go on for probably another hour, but I'm going to wrap up this episode.
Okay.
So in closing, just if there's a couple tips that you could share with women that are interested in having a natural birth, what would you recommend?
Well, I'm biased. I would say take my course, or at least read my book, The Natural Birth Secrets. But what would I recommend? You mean like one thing?
It could be a couple things. I think, what I'm hearing is probably, interview for a midwife, right? That would be one way.
Yeah, well, I would say the modern woman today just needs to. I would say there's a few books I would recommend. To read up about like Orgasmic Birth, Ina May's Guide to Childbirth, Mindful Birthing, Birthing from Within. There's some really. Or Orgasmic Birth. There's some really wonderful books out there. My book is Natural Birth Secrets, but just so that a woman can sort of empower herself with not just information, because this is so beyond the rational mind. It's how can we learn to remember what our body knows how to do, and how can we get out of our heads, and how and trust the process, and we know we have a lot of negative, right? But how can we surround ourselves more with the inspiring, with the uplifting, with the positive, with the ecstatic sort of birthing experiences? Yes, birth can be absolutely ecstatic, even though it can be absolutely challenging and intense. So it's not that dissimilar from, I have a lot of athletes that I've helped in my practice. I had a mountain climber, like a real mountain climber, with the ropes and and she kept telling me this is like mountain climbing, and I don't like to engage them in too much conversation when they're in the heat of labor, but afterwards we talked about it, and she was like, yeah, because she's going up almost like a 90 angle incline with these ropes, and she gets to the top and she's tired, and then she realized, this is hurting and that's hurting. And then she thinks like she got to the top, and then she sees that like the next mountain is like triple the size. And so she's like, oh, okay, she's not going down. She can't do that. She's going up, right? So she's going to go up, and, and it's hard, and she's sweating, and things are hurting, and tired, and she's hungry, and she thinks she can't, and da, 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 da. But something in her, she finds this thing in her, that this strength, this power that and she just does it. And then she gets to the top, and then she sees like, now the top, there's another, like the top really, there's like 6 times the size now she's got to climb to get to the top. But, so she does it. And when she does it, she's like, wow, I did that. Yeah. It's like, and so it's not that different. It's a mindset, it's a mindset. We can learn to shift our mindset. That all successful people are not like, they interview, my son's very into sports. So, he got me into, but like Mike, they interviewed Michael Jordan and people like him, how is it that, at the last 10 seconds of the game, you just, you're losing by whatever, how many points, and you make, 3 layups and 4 3-pointers, and you win the game at the buzzer beater. How come you always do that? What's the secret? So they've studied people like him, and unanimously, it's a mindset. It's a mindset. Because I know I'd make the shot. I'm going to do it. It's not like I think I can. I'm afraid. Maybe I should try. We can shift our mindset to. We can use our mind to work in the favor of this. To empower us, to propel us, to give birth. And to live in our power, take back our health, take back our birth, because we should not be relinquishing it to other people. Even if we need even if we need high risk care, it's still our bodies, and we can, we still need to be cooperative in that arrangement with whoever we're working with, and it's a holistic approach, right? It's not,
and I like what you just said. It's a team, it's really 2 people coming together and having a conversation about what is, the options, and then making a decision from there.
Yeah. And that really, no one is going to save us. We have the power, like that's, one of the things, like people are always looking for happiness and peace and a better life outside of themselves. It's really within that we're going to find that. And so, breath work and birth will, pregnancy is the journey, hopefully I'd like to lead women into the journey back to themselves, to reconnect. We're just on the phone all the time, disconnected from ourselves, from life, from each other. And I just, as much as I'm on, I do have the social media following. I really am into unplugging, because I think people are just, it's doing, we have to balance. It's doing a disservice, get off the phone and connect to yourself, to life, to others. I think that's a big, that's a big help too.
Well, Anne, I'm just so grateful for you to take the time to come on today. I know you were at a couple births last night. You've had a long night, and you sound like you could run a marathon right now. You're energized, you're passionate, and you have a strong purpose and vision. I can see, that you're just want women to know what's possible for them and what's possible for all of us. We can really have the lives that we want to create. If we believe we can.
Yes. And I want to end with, there is no failure in birth, because whatever journey, like we make all these plans, we're in the modern day, we're into controlling everything, and birth is all about, we have no control. We absolutely have no control over most things. But yes, we make all these plans. We can make preferences. We can plan for the birth of our dreams. But when in that moment, there is no guarantee how things are going to go. And actually, most things don't go as we expect. And that could be, you wanted a water birth and it ended up you gave birth on the sofa, or you wanted your kids at the birth and the kids were distracting you, so the kids were not at the birth, or a person ended up needing a compassionate use of an epidural, which helped her have a vaginal birth because she was exhausted and had a prolonged posterior labor. There's or she ended up with a cesarean. There are, when in it, can we learn to surrender to what is and love what is, and actually embrace whatever journey we had as the gift meant, especially for us. See, that's where the spiritual perspective, I can't practice without it. It's whatever happens is actually what was supposed to happen, what was meant to happen, what was my journey with the journey for my baby. And can I be grateful for it, even if it's not what I wanted, right? Because we don't always get what we want. We get what we need. Right. So that's just, I just wanted to end with that, because really there is no guarantee. And even when there are, complications and we need a cesarean birth, we need to really be grateful for like modern medicine that saved. Yeah. In life-saving situations. And that's a birth to celebrate. Yes, we'll have to heal more from that emotionally, physically, but thank God, we have these options there if we need them. Right. So it's
awesome.
Yeah.
Well, thanks again for coming on, and I really appreciate you.
A pleasure.